Good morning, everyone. We're making an early start. Thank you all for coming. Our Honorable Minister of Health, Dr. Frank Anthony, is acknowledged. Our PAHO PWR, Dr. Luis Codina, at the head table. I also wish to acknowledge Dr. Karen Broom. She is the EPI Caribbean Manager. We also wish to acknowledge at the head table Dr. Alvaro Wittenbury. I hope I have your name correct. Dr. Wittenbury is visiting us from Peru. And last but not least, at the head table, we wish to acknowledge Dr. Oscar Vargas. He is the man that has been helping the Caribbean and the Latin American region access vaccines from the revolving fund. To our other visitors to Guyana, we wish to acknowledge the presence of Dr. Mauricia Marza, and she is from the Cancer Prevention Program in PAHO. We wish to acknowledge also the presence of Dr. Ana de Prada from Argentina. We wish also finally to acknowledge the presence of Ms. Gina Joseph, who is our international PAHO consultant from Trinidad and Tobago. In our room, we'd like to locally acknowledge all our PAHO colleagues, Dr. Janice Holford, who leads the family health program at PAHO. We'd like to acknowledge the presence of all our senior health visitors, our medical officers from the Georgetown Public Hospital, our medical officers, nurses, public health nurses as well from primary health care and the clinical sciences. Welcome, everyone. For the next 3 days, Guyana will spotlight saving lives, because that's what we're in the business of. Cervical cancer from HPV is very much preventable. So a few decades ago, scientists looked at the fact that we had vaccines against a few viruses. We could prevent influenza from becoming a serious fatal infection. We could prevent deaths from hepatitis. And then someone had the marvelous idea from which we all stand to benefit. Hey, why not prevent deaths from cervical cancer? After all, that's caused by a virus. And the HPV virus is one of the most common viruses that we have on Earth. We're not even going to, at the beginning, associate it with a sexually transmitted disease, although it is. And then voila, we had a vaccine in 2006 that could actually save lives from cancer. Public health made groundbreaking strides. Fast forward to 2024, countries like the UK, Australia, Canada have announced about 70 to 90% reduction in cervical cancer lesions, as well as cervical dysplasia. Now that is groundbreaking. And the Latin American territory, Guyana included, will not be left behind. So for the next 2 days, we will welcome you to an array of groundbreaking knowledge, updates on how the world is moving ahead with preventing cervical cancer, and how the world is moving ahead with implementing strong HPV vaccination programs. At this location in Pegasus, we will be able to explore what are our challenges in Guyana, what does our HPV vaccination coverage looks like. And on the third day, at another location, the expertise that has visited the soil of Guyana will sit with the PAHO team and the local team, and we will seek to strengthen the capacity to deliver preventative care in reference to the HPV vaccine. We will work on our strategy, our communication strategy, as well as our administration plan for the HPV vaccine, and of course, the prevention of cervical cancer and all of the other facets. Without further ado, if you turn your attention to the program, we have the honor of welcoming our PWR, Dr. Luis Codina, who has partnered very integrally in the last few years of his stay to help in all public health assets and facets to develop this program. We know that he's a key partner in this fight, and Dr. Codina will share with you brief remarks on why we're here today and what we hope to accomplish. Let's welcome Dr. Codina.
Thank you, Dr. Scott. Good morning, everyone. Good morning. Honorable Minister Frank Anthony, colleagues from PAHO, from the region, from Argentina, Chile, colleagues from the PWR Guyana, Dr. Robert, Dr. Wolf, Angela, and all the team. We are very pleased to open this. It's a workshop. Even if it's a scientific conference, it's a workshop because we want to exchange the experience from other countries to Guyanese authorities and health workers in the country. This meeting has three very clear objectives. The first one is to show the evidence related to HPV and other activities for elimination of cervical cancer in the next years. The second one is the exchange experiences between Guyana and other countries, in this case Chile and Argentina, to see and to analyze how it works, what they did in terms of selection of groups, selection of vaccines. You know that the evolution in the last 10, 15 years was so fast, so rapidly in terms of new vaccines with more components and other aspects in terms of new groups included in the vaccination, etc. So this is a very important thing, to analyze what is the most fitted, the better fitted program for the country related, and this is the third point. How can we plan for the next years? I think that we need to begin for this year, a campaign of HPV vaccination as one of the pillars of the elimination of cervical cancer. It's not the only one. We need to screen, we need to treat, we need to complement with other integrated activities to have really a proposal to eliminate the cervical cancer. It's not only the HPV vaccine, but the HPV vaccine is a very strong tool to work in this way. So the third thing is, how can we plan for the country and for some regions to develop the campaign for HPV? How many people, which are the groups, what kind of vaccine we need, how can we organize it? And the challenges in this process will be the social communication. The social communication, we suffer a lot after the pandemic infodemic and bad information related to the vaccine, etc. It was not, Guyana was not too much impacted in this area. Other countries was terrible. They receive a lot of bad information and they create a lot of resistance to be vaccinated, for example, for the COVID-19. So we need to work very smart in terms of the groups that we select. The places, schools, for example, is an excellent place, but we need to work with teachers, with parents, to understand really what is this vaccine, what means this vaccine for the future, because it's not a vaccine for example, a measles or something immediate. It's for 10 or 20 years in the front. So sometimes it's difficult to understand that we are working for the new generation to eliminate the cervical cancer in the future. So it will take time. It will take a lot of effort, but this is an important step for the country like Guyana and for all the sub-region in the Caribbean sub-region. So we are here for these three areas, show the evidence, exchange the experiences, and let's planning an excellent proposal for the introduction, the reintroduction, because already is introduced on the country, the HPV, but to elaborate a plan to vaccinate during this year. If I don't know if the plan is, I think we discussed with the minister, it's for this year to elaborate a campaign. But we know that we have a lot of challenge, but we need to work together to surpass these challenges. Specifically, for example, I don't think it's a problem, the logistic, the cold chain. I think all the countries very well prepared. They have a lot of experience in vaccination. There is not but the point is, how can I get to the schools in a good message with the parents, the teachers, and the children also, because they are pre-adolescent and adolescent, for example, to receive the vaccine. No? This is the key issue, because we know that the coverage is between 20 and 30 in some places, so it's not a huge coverage, but we can get this coverage very high if we really move a campaign, including the social communication as a very strong way to change a little bit this infodemia and this kind of information that make a lot of problems in some other countries. Not in Guyana, but in other countries, yes. So thank you for being here, and thanks for the team to support us for these 3 days of work. And we expect to have a very good result at the end of the meeting, seeing in the future the elimination of the cervical cancer in this country. Thank you very much.
Thank you, Dr. Codina. Essentially, what you just heard is, how do we fight? How do we sit? How do we strategize? How do we plan to save lives? It sounds like a laborious task, because saving lives should be quite easy. Everybody should want to have a health benefit. Everybody should want an intervention that does good. Sadly, that is not the case with all public health measures. In 2022, when the UK announced that some 450 women are saved annually now from cervical cancer because of the introduction of the HPV vaccine, the world was ecstatic. Because as you all know, Australia is the gold standard. But there's something that's showing that there's progress in countries that started later than Australia. Like the UK, in 2019, Guyana introduced HPV vaccines to boys as well. And what that is showing in data from data in North America is that there is now, although a reduction in cervical cancer cases, an increase in cancers of the throat, head and neck related to HPV in places that were not administering vaccines to boys. And although the timeline seems to be a little over 20 years, it's still significant. Now, you all know that behind a good public health measure, there is political will, political buy-in, and that has to be one of the leading platforms to make any vaccination program or any public health program successful. I'm here to tell you what most of you working at the Ministry of Health already know, what most of you from the region already know, that in our ministry, there is no shortage of political leadership and political buy-in. To lead the cause for the elimination of cervical cancer, our Minister of Health, Dr. Frank Anthony, has been very honorable, setting the meetings weekly from his office, sitting in the meetings and leading the strategies, debating the strategies at the level of the government and his colleague ministers at cabinet, bringing us back to the table, sometimes even administering lashes for the slow approach. He has heard the challenges, he has listened to the obstacles, and he is insisting on leading the charge to push forward. If you heard what Dr. Luis Codina shared with you a while ago, it is no easy struggle to fight to save lives. It gives me pleasure to announce and to confirm that Guyana stands as one of the countries that is exceptional in political will and leadership for the elimination of cervical cancer. I now invite our Honorable Minister of Health, Dr. Frank Anthony, to give feature remarks at the moment. Dr. Anthony.
Thank you very much, Dr. Scott, Dr. Luis Codina, the head of PAHO here in Guyana, other distinguished persons at the head table, ladies and gentlemen. First of all, allow me to thank the Pan American Health Organization for partnering with the ministry for us to hold this workshop. We have had these discussions for quite some time now, and our desire is really to work on multiple fronts as we bring relief to our population. So I want to start first by talking a little bit about where we are with chronic diseases, then talk a little bit maybe about our direction in terms of cancer. Chronic diseases or chronic non-communicable diseases have been a major problem in our population for a long time. But we did not have aggressive programs to mitigate some of the consequences of these diseases. Over the last 2 to 3 years, we have been actively working with various partners to try to mitigate the morbidity and mortality from chronic non-communicable diseases. So last year, one of the things that we did, we worked with the Mount Sinai group, and we've been able to do a lot of work in terms of diabetes. So we have new guidelines, we have been implementing these guidelines, and we have bought the medication to make sure that we have better control for diabetes. And this is going to continue. And apart from the guidelines and so forth that we have introduced various programs that we can mitigate the consequences of complications from diabetes. So things like kidney failure. What do we do if somebody has kidney failure? What do we do if somebody needs help with peripheral vascular diseases that you encounter and so forth? And we have even created a one-stop shop, in a sense, at Lusignan for diabetic patients, where you can go there and get all of the services. We started this as a pilot, and of course PAHO has been instrumental in helping us to put together some of the guidelines and so forth. But we started this as a pilot, and we have seen the benefits of having such a center. And now we are thinking about rolling this out to other regions so that you can have comprehensive diabetic care. While we have had that focus on diabetes, we also have a program where we're looking at hypertension and cardiovascular diseases. And this is a program that PAHO has been championing across the region of the Americas. It's called HEARTS. And we have implemented HEARTS here in Guyana. We're more than 120 different health centers. We have changed out the medication, and we are getting better control with these new medication for our hypertensive and cardiovascular patients. So that is going to continue, and we want to roll this out to all of our health centers so that our patients who come to us would get better care. Now, when we look at other diseases, so apart from hypertension and cardiovascular and diabetes, which are very prevalent in Guyana, we looked at cancers, and what we found is that among women, breast cancer is the #1 cancer among women, and cervical cancer comes second. Among men, it's prostate cancer. And of course, these are the more prevalent ones. They have other types of cancers that affect our population, but these are the most prevalent ones. And when we look back at how we have been managing these diseases, we did not have a comprehensive program. What we had was somebody trying something in isolation of a very comprehensive program. So for breast cancer, we are good at raising awareness, and we have had lots of partners who have helped us to raise awareness. So much so that everybody in the country now know about Pinktober, where every October we get together, we talk about breast cancer. But it's one thing to raise awareness. The other thing is to get services. So if we raise awareness and people don't get services, then what are we doing? So we started to change that, and we have introduced people being able to access mammograms, which is now available free of cost at the Georgetown Public Hospital. And this year we are hoping that we can introduce mammograms at West Demerara, New Amsterdam, and in Linden, so that people can access mammograms. And of course, if we are able to make early diagnosis, then we can have early interventions. Just about 3 weeks ago, if you had a mammogram and a mass was detected and you did a biopsy, we were not sure whether or not, first of all, the turnaround time for you to get the results from that biopsy would have been maybe about 3 months. 3 weeks ago, we opened a new pathology lab so you can get back results within 24 hours to 4 days. But more importantly, in the treatment of breast cancer, sometimes you need to do certain differentiations. There are certain markers that you need to look at. And before, that was either quite expensive if you had to go get it in the private sector, and none of the private sector labs were able to do those particular tests here in Guyana, which meant that they had to send these samples to Miami to be tested, and sometimes they have problems sending out samples because the airlines would not take them. We have changed that. Our pathology lab now can do a lot of differentiations, do a lot of markers. I think right now we are doing more than 12 different markers, and that is going to increase. But apart from that, one of the things that we are capable of doing now at the pathology lab is that we can take high-resolution images of the slides, and then that image is sent to a reference center. So in our case, we are sending these images to Mount Sinai Pathology Lab, where we can get a second opinion. So you don't have to send a physical sample for a lab to be able to look at it. We take high-resolution images and we send it abroad so that they can read from those images. And I think they're calling that digital pathology. So we are able to introduce digital pathology in Guyana, and it has been working. So we have made a big advance in that direction. Now, when we come to cervical cancer, the technologies to treat, to prevent, have been around for a long time. Just about a week ago, I had the good fortune of being at the university where you had a Nobel Prize winner. And he won the Nobel Prize in 2008 for his work in cervical cancer. Now, but this technology has been around. The vaccine has been around for a long time. Why we have not been able to scale this up? There might be various challenges, but this is something that we need to address head on. In Guyana, we have had a remarkable track record in terms of immunization. For the children, we gave maybe about 18 different antigens, and our track record has been between 98 to 100% uptake or coverage. That's remarkable by any standard. But when it comes to HPV vaccination, we are way, way, way down at the bottom. So either we are not putting a lot of emphasis on HPV vaccination, we don't understand the implications or how this is going to help people. And if we don't understand that, then maybe that's why we are lagging. We want to change that. We want to change that because if cervical cancer is the number 2 cancer among women, and this is preventable by a vaccine, then we want to make sure that every child in this country is protected. The cost for such a vaccine and getting it through PAHO's strategic fund is minimal, right? We can afford to buy it. So that's minimal. But think about if somebody actually got cancer, what it's costing the country. Because we have to get that person in the hospital, we'll have to do some expensive surgery, they'll probably have to go through radiation, you've got to get brachytherapy, that's quite expensive. At the moment, we don't have that in the country, so we support those patients to go abroad, and it costs a lot of money. It's a fraction of the cost if you have to get a vaccine. So from an economic point of view, it's much better for us to get everybody vaccinated to prevent this cancer from occurring. But that's one side. The other thing is the implications. If you get cancer, the worry that people go through, the uncertainty, you're not sure about the outcome, depending on the stage in which you get diagnosed, the outcome would vary. So for a lot of people, it's a very stressful time when you have such a diagnosis. All of this we can prevent. So we decided in the ministry that we want to have a very comprehensive program as it relates to cervical cancer. The first part of the program, we want to emphasize prevention. How are we going to prevent this from happening? We need to have HPV vaccination. We don't want the numbers that we currently have, which is quite low. We want to change that, and just like every other antigen that we've been administering, we want to take that up into the 90s and possibly to get 100% coverage. So that's what we are going after. Now, for persons, and I know that at the WHO level you have the 90, 70, 90, is it? Right. We don't want 90 as our thing. We can go beyond 90. So that's our aim, to make sure that we go beyond the 90. Because I think we have demonstrated that we have the know-how of making sure that we can go beyond 90. So while we focused on children between the ages of 9 to 15, we have also changed our guidelines based on the latest science to look at persons between 16 to 45. And we want to make sure that those persons also get their vaccines. So in the first instance, we want to have a very clear focus on women. So basically a child from 9 to 15, and then from 16 to 45 to have persons covered. That does not mean that we are not going to work with boys, because the vaccine has also been proven to prevent certain types of cancer among boys, right? So we want to give them the vaccine as well. And so while our primary focus might be on cervical cancer, the vaccine is also beneficial for boys and men, because when you get the presentation from the cancer registry, you will see that we also have anorectal cancer and a whole host of other things that can be prevented by this vaccine, right? So the first phase of this exercise is to make sure that every eligible person in Guyana can get HPV vaccine, right? The government is going to provide the vaccine free of cost. We are going to buy it through PAHO's strategic fund. We have this partnership for a long time. We've been working with them for a long time in other areas, and this is just another area that we want to expand our relationship. We in the ministry, we have a lot of know-how in terms of how you administer the vaccine. We're not short of that. We have, in every region, in every village, we have people trained to administer vaccines. So that's not our problem. We don't have a problem with cold chain. Just last year, we changed out some of the refrigerators. In fact, last year we added 166 new refrigerators into the system. We have about 360 different health facilities, health huts and health posts. Almost all of them have refrigerators. We have, and most of them are solar, so we don't have to depend on the electricity in communities that don't have electricity. So we don't have a problem with cold storage. We have the whole cold chain well mapped out, and over the last 2 years, one of the things that probably with COVID that we have benefited from is that we have made sure that we strengthen our cold chains. So apart from the fixed sites that we have where we have all of this equipment, we also bought a lot of carriers to make sure if you got to move and go to a village that does not have a refrigerator, that we have the carriers. So there's no excuse there. None whatsoever. We have the equipment, we have trained people, we have the vaccine. So what is stopping us from getting the population immunized? There's nothing stopping us, right? Now, I want to see by the end of this year that the numbers that we have go up in a very significant way. So all the persons who are here representing the different regions, this is not an add-on. This is not something that you do in your spare time. This is now part of our routine immunization. This is what we are offering. So every child that is eligible now must get it. This is not some extra thing that you do. This is now part of our overall strategy. And we need to treat it as such because it is important. While we are doing this, there's another program that we're running. And the two things can tie together. That program is our school health program. Last year we started out where at nursery level, we started to screen children. We're checking their eyes, checking their ears, we're checking their mouth, and we do an overall checkup for them, including making sure that they have the age-appropriate vaccines. This year, we want to continue at nursery, and we are going to start primary. So we have a target this year of reaching 87,000 children. And as we go into those schools and get to the children, to do the screening for the children, we also must use the occasion to talk about vaccination and other health concerns. And any health problem that we detect when we screen these children, We have to bring them into the health center or the hospital and fix those problems. So while we have set aside the resources to do this in this year's budget, right? So I think there's synergies between our school health program and this vaccination using HPV that we'll be doing. So we have to make sure that the two things work together, right? I wouldn't go into all the details of what we'll do with school health and the other things and so forth, but I want to focus this on HPV. So we want to get our population vaccinated. Now, while our focus would be on 9 to 15, I know sometimes if somebody come in now that they're 17 or 18 or 20, they come in, they come to the health center, sometimes we give them a hard time. Because in some cases we'll tell the people this is only for 9 to 15. But we're doing from 9 to 15 for the children, and from 16 up to the age of 45 for other women. And there's a protocol that we have developed where they can get these vaccines. So I don't want to hear complaints that women turn up at the health centers and then they can't get vaccine. They can't get the HPV vaccine. Because we have taken a decision where this is now going to be available. Are we clear? The other thing that we want to do is that we also want to offer, after you get your HPV vaccination, we're going to focus on that. But we also want to offer pap smears across the country. We want to offer VIAs, and we have started doing that. But we need to have more of this done almost at every health center. So we need to train people to be able to do this. This year, we are also going to introduce HPV testing. Right now, it's unavailable in the public sector. There are some people who are doing it in the private sector, but it's very expensive. The cost for an HPV test in the private sector is $25,000. Right? So we want to offer that across the system. And that is something that we'll work out during the year. Right? And of course, age categories and so forth. So where we're talking about the 70, as the WHO would have said, we want to make sure that people who are eligible for these tests, that they would be able to get the tests, which means we have a lot of work to do to put these things in place. Then for those persons who have been diagnosed, we want to make sure that they're properly treated. So we have surgical capability. What we don't have brachytherapy in the country. So that is something that we'll examine, and we'll make sure that we set the system in place to be able to offer brachytherapy. But I think if we focus a lot of our energy on HPV vaccination, that in a couple of years, maybe in a decade, we can see the effects of that. We will be on the pathway to eliminate cervical cancer as one of the major cancers in the country. And I think all of us would like to see that happening. Because if this is number 2, and we can change it and bring it to number last, that's a big achievement. And that's what we should be working on, right? So with a simple vaccine, we can make a big difference. So that is why we want to launch this thing where we can end cervical cancer in Guyana, right? And that's what we're starting here today. So I hope that over the next 2 days, I see you have a very packed agenda. What I want coming out of this meeting is that we look at where we are in Guyana, where the challenge is, what are the difficulties, focus on those, and so when we leave the meeting, we have concrete things to do. I was telling Dr. Codina earlier when we were talking about this workshop, I said we really don't need much information and evidence. This thing has been around a long time. Why we need to come back and tell people who are in the field what is the evidence? They should know the evidence. What we need now is to make sure that we are implementing. But I suspect sometimes we need to remind people of the effectiveness of some of these public health measures that we can adopt. So while we do the reminding and you get the science, we want you to use the science to convince people that this is the way to go. And we will have some resistance. I remember about 2-3 weeks ago, I was talking at a community meeting to people. And I mentioned some of these programs that we have in the ministry and we make them available and so forth. And then there was a guy in the meeting, so after the meeting finished, he's standing there and he's saying, well, he doesn't think that people should take the vaccine. So I said, why? He said, well, he heard that the vaccine, when you take it, you become infertile. This is a person who probably dropped out of primary school, right? Drop out of school, probably never did science, never did anything, didn't read nothing about this vaccine, but he heard that this is what's going to happen. And based on what he heard, well, maybe some uneducated person like himself might have told him. So he has formed a view. That is what we are going to be up against. People with views that they've heard somewhere. So we have to make sure that we change those views and we build a momentum so that this becomes the norm. We have been able to do that for all these vaccines that we have been giving children, and we have seen the successes of this program. Because a lot of things that people used to get in the past, that was very common, the diseases, they no longer have them because of our strong immunization program. This is just another disease that we can conquer using vaccination. So this is the task. I don't want to see those low numbers that we have had over the years. I want us to look at the challenges, fix them, and let us implement this thing at scale. And that's another thing that I don't really like, when we try to pilot something. If the evidence is there, let us do it at scale, because a lot of times we pilot things and the plane don't take off. Right? Because it remained in one community or two communities. We need to do it at scale because the evidence is there. The countries that you have here, I think you have Chile, Argentina, they have done these things. And you'll see the difference in what they have done and the successes that they have gotten. Right? Why can't we do it? Why are we so different? We're not different. We just need to put the effort in and educate people and get this done. And I think once we have done that, a couple of years from now, we can come back and reflect about where we were and now where we are. And we want to be a model for other countries. If you ask me whether we can do it, of course we can do it. Because I'm very confident with the people that we have in the ministry who have had years of experience in doing this. So this is nothing new to us. We have done this, and even during COVID, when a lot of countries saw their immunization coverage, when those coverage decreased in Guyana, we only had one antigen that was at 89%, I think it was. And this was during COVID. So we have the know-how. What we need to do now is to apply it and make sure that we have strong HPV coverage across this country. And so that's the task before us. And I hope that when we conclude this meeting, that we'll have very clear-cut recommendations pertaining to our national program, pertaining to every region, what it is that we need to do to make sure we increase the uptake of HPV vaccination here in Ghana. Thank you very much.